Today, we're looking at some incredible research, something right at the intersection of neuroscience, AI, and really the future of mental health care. We're going to explore a new technology that offers a real glimmer of hope for one of psychiatry's biggest, toughest challenges. I mean, it sounds like something straight out of science fiction, right? The idea that an AI could just look at a scan of your brain and tell a doctor exactly which medication is going to work for you. But, as we're about to see, this isn't fiction anymore. It's the very real question at the heart of a truly groundbreaking study. But, okay, to really get why this question is so important, we've got to start with the tough reality that millions of people are facing right now. For so many, the path to feeling better, well, it isn't a straight line. It's this frustrating, often painful process of just guesswork. So let's dive into what we're calling the treatment guessing game. And we're going to look at this specifically through the lens of bipolar disorder, a condition that's really defined by these intense mood swings, from the highs of mania all the way to the lows of depression. And look, this is not a rare issue at all. When you factor in the entire spectrum of the illness, it affects up to 6% of the population. That is a huge number of people whose lives can be completely turned upside down, which just highlights how urgently we need better, more effective treatments. So try to imagine this. Someone is going through their very first manic episode. They finally get a diagnosis, and now their doctor has to make this massive decision. Do they go with lithium, the classic mood stabilizer, or maybe an antipsychotic or an anticonvulsant? The honest truth is, right now, there's just no clear way to know which one of those is going to be the key for that specific person. And this really gets at the human cost of this whole trial and error thing. A patient might be on a medication for weeks, maybe even months, dealing with all the potential side effects, only to discover it's not working. And then the whole process just starts all over again. It's an absolutely draining maze, physically and emotionally, for patients and their families. Okay, so this brings up a pretty logical question, right? I mean, in this age of incredible medical tech, why can't we just look at the brain for an answer? Why is this still a guessing game? So, yeah, why is it a guessing game? What are the real scientific hurdles? What's stopping us from finding a simple, clear-cut test? Well, these are the roadblocks that researchers have been hitting their heads against for decades. They've been on this hunt for what's called a biomarker, basically a simple clue in our biology, like something in a blood test or a genetic marker that could predict who will respond to what. But for mood stabilizers, they've found nothing. Even our most advanced brain scans haven't managed to find a reliable signal, mostly because the brain's mood circuits are just unbelievably complex. They don't work in a simple straight line. And this is where our story takes a really interesting turn. If the problem is too complex for simple markers, well, maybe it's a job for a much smarter tool. So let's meet Lithia. It's a new kind of AI that's basically designed to be a medical detective for the mind. So Lithia is built on two key AI ideas. The first one is something called a genetic algorithm. The best way to think about it is like survival of the fittest, but for solutions. The AI basically tests out thousands of different ways to solve a problem, and only the best ones survive and get to influence the next round. It's a super powerful way to find the best possible answer when you're dealing with just a ton of data. The second piece of the puzzle is called fuzzy logic. Now, unlike a regular computer that only thinks in black and white, ones and zeros, yes or no, a fuzzy system can think in shades of gray. It can work with ideas like very high or kind of low, a lot like a human doctor would. And this is what lets it make sense of all the messy, complicated data you get from a brain scan. So you combine those two, and that's the magic of Lithia. It uses that survival of the fittest method to learn and evolve, but it uses that fuzzy shades of gray thinking to understand what it's seeing. And honestly, here's the most incredible part. It can explain its reasoning in plain English. It'll give you these if-then rules. So it doesn't just spit out an answer, it actually shows you its work. All right, so you've got this powerful new AI. The next obvious step is to put it to the test. A really high-stakes test. Could it actually predict who would respond to treatment in real live patients? The experiment itself was pretty straightforward, but really powerful. The researchers took 20 people, all newly diagnosed, and did brain scans before any treatment. Then, every single one of them was treated with lithium for 8 weeks. The challenge for Lithia was simple. Look only at those before scans and predict for each person who was actually going to get better. And we're not talking about simple data here. Lithia was fed information from 2 different kinds of brain scans. One looked at brain activity,
the other at brain chemistry. All told, that's 108 different data points for every single patient. It was building this incredibly detailed picture of the key emotional and thinking parts of the brain, all to find hidden patterns that no human could ever spot.
Now, to really see how good Lithia was, the researchers threw 8 other, more standard AI methods at the same data. And this one quote from the study, it's just wild. In one of their tests, there was only one person who didn't respond to the lithium. And guess what? Only Lithia correctly pointed that person out. Every single other AI got it wrong. And the final results? They were absolutely remarkable. Across all the tests, Lithia hit perfect, 100% accuracy. It correctly identified every single responder and non-responder. The other 8 AIs, on average, they were barely better than flipping a coin. So this wasn't just a small step up, it was a massive leap forward. So what does all this mean for the future of personalized psychiatry? Well, look, these results are incredibly exciting, but the researchers are being very, very clear here. This is a promising start, but it's the start of a very long road. So let's get a balanced look at this. The promise here is just enormous, right? A future with faster, more efficient treatment, fewer unnecessary side effects. But the reality check is that this was a small study, only 20 people. These results absolutely need to be tested and confirmed in a much larger group. And of course, these kinds of brain scans aren't exactly routine or cheap just yet. So the big takeaway is this. Lithia isn't some tool your doctor is going to use tomorrow. But what it is a powerful proof of concept. It shows that if we use the right kind of AI on this super complex brain data, we actually can find those hidden signals. It proves that a future without the treatment guessing game is actually possible. And that just leaves us with one final thought to chew on. What if your future treatment plan wasn't a guess at all? What if it was a precise prediction based on the unique wiring of your brain? We started this whole thing with a sci-fi question, but this research shows that future might be closer than we think.